Back in the national capital, migration of nurses and other health professionals has the potential of undermining Ghana's drive to attain universal health coverage by 2030, says the Chief of Staff, Mrs. Akosua Frema Osei Opare. Mindful of this, government will scale up infrastructure development in the health sector and train more health professionals to ensure that Ghanaians will have access to quality healthcare.
International Nurses Day is celebrated annually on 12 May in memory of the birth of the founder of modern nursing, Florence Nightingale. At this year's event held in Accra, issues that dominated the discourse were nurses' welfare and the migration of nurses from Ghana to seek greener pastures. According to the Ghana Registered Nurses and Midwives Association, within a period of 2 years, over 6,000 Ghanaian nurses have migrated to other countries. The president of the Ghana Registered Nurses and Midwives Association, Mrs. Perpetual Oforiampofo, called for a stakeholders' engagement to turn the brain drain into brain gain.
The reasons nurses gave for leaving Ghana has not changed. It's still the same today. So we need to strategize, and we feel that we need to increase the training. Increase the training, but not of what we are seeing now. We need to stop the auxiliary training program. Once we beef up the training, we'll have enough of professionals to meet our own needs and at the same time be able to go into bilateral agreements with countries in order to export our nurses.
The Chief of Staff, Madam Akosua Frema Osei Opare, said health is synonymous to the wealth of every nation and government will continue to invest in the sector.
To remedy this situation, a more strategic approach towards training and maintaining more nurses will help us prepare adequately for the next pandemic that will potentially hit the globe. I therefore task the Ghana Registered Nurses and Midwives Association to urgently organize sensitization workshops, conferences, seminars to reorient its members on the need to remain committed to serving Ghanaian citizens. Government is therefore committed to expanding the healthcare infrastructure in Ghana and also provide the needed resources to ensure quality output of healthcare workers in terms of care.
The Omahini of Isikado traditional area in the western region, Nana Kobnan Kitia, urged the association to develop more innovative skills to improve quality healthcare.